Good afternoon. So I have the honour of speaking to you post-lunch. So I know as most of you are sitting there with full bellies, it might be hard to pay attention. So one thing you'll notice about me is I'm quite gesticulative. I will use my hands a lot. I tend to vary my tone a lot. So I'm hoping that will keep you awake. So Deb asked me to present this probably about a week and a half ago. So I had a week and a half to put this together. So please forgive any of my slides if there's some grammatical errors, or if anything doesn't make sense. I'd kind of like to make this a bit of an interactive session if we could, because it's kind of a smaller group. So I'm happy for anyone to add anything they'd like in. So let's go. So Deb's already mentioned, so I used to be a chiropractor, so I'm sorry if any of you really don't like chiropractors, okay? But I'm not anymore, I'm now in psychiatry. A lot of experience teaching. I have two young children and married to a firefighter. I have a big interest in lifestyle and social interventions in mental health because I'm currently in the community at Tukley in Longjetty. So I see a lot of the chronic patients that we have with mental health. So I get the privilege to actually get to know these people quite well, and I get to ask them probably a lot more questions than what you would have the time to do in general practice. So it gives us time also to consider other ways or creative ways that we can implement social prescribing. So, has anyone actually heard of social prescribing before? Few people? Great. Okay. I'm going to be honest with you. It's something that I actually, when I heard about it, I'm like, what's social prescribing? And then I realised it's what we actually do all the time in mental health, just without realising it. So it's actually implemented currently in the UK and in Canada. And so there's not a lot of studies done. There's some qualitative studies done. But in the UK, they've implemented since, I think, 2019, a social prescribing program. So it's part of the NHS long-term plan and with their primary care networks. So it's mainly targeted at different sorts of patients, mainly those who are socially isolated and with long-term physical and or mental health conditions. So this is something from the UK. And again, it's just that idea that it's not just one thing that makes us healthy. It's not just our mental health. We're holistic human beings. We have social connections. There are lots of other things in our life that are going to contribute to our mental health. So there was a roundtable meeting for the College of General Practitioners. For those GPs in here, you may or may not be aware of that. And that was a social prescribing roundtable. And that was done in 2019 in November. So the idea around that was to actually look at the evidence around social prescribing and what we could currently do in Australia and implementing a longer term plan. I love Grumpy Cat. So the whole idea of why socialise when there's perfectly good Wi-Fi and food at home. I have days when I feel like that. Okay, so when they had the meeting, the roundtable meeting, what they were looking at is what things could we implement by doing social prescribing. So preventing and managing physical and mental illness, shifting the focus from illness to wellness, which I think is a really important thing for us to look at. So particularly in terms of preventing hospital admissions or from people representing to hospital, if we can look at supporting wellness rather than just looking them at illness. Increased consumer enablement and self-management, if we can help patients to become more sufficient in and being able to rely on social connections in their health. Decreased demand for health services, greater value care, fewer gaps between health and community services, increased joy and decreased helplessness, decreased isolation and stronger communities. So essentially all the things too that Michaela had been talking about before. If we can have stronger community supports and if we can have people engaging and having those supports that they need in the community, then that's going to help us. in terms of preventing people from relapsing. So this is like a sort of typical idea from the UK, the whole idea of our social prescribing in the sense of, so things like being more active, okay, supporting your mental well-being, being healthier, being more socially connected, living well and more independently, and support with your finances. So that's kind of, I guess, a snapshot, but I just want to ask too, the GPs or people in practice here, who finds it difficult to implement these kinds of things with patients? Like, if you say, do you eat well? I mean, I find when I ask patients that question, when they say, yeah, I eat well, and then you realise what they actually eat, and it's just McDonald's, KFC, 2-minute noodles, flavoured milk. And so actually going down to that a little bit further and understanding and educating them that that's actually not very healthy. So even things like cooking classes for them, you can go, so there's free nutrition classes and things like that people can go to. How they're living, are they in social housing? Are they living alone? Are they living with people that do drugs? Those sorts of things. How well do they manage their finances? Do they have financial support? Is it through Centrelink? Do they have a part-time job? How secure do they feel? All those kinds of things come into play. And being active, I know we always say, get more exercise, do more exercise. But I feel for a lot of people that sort of doesn't translate to much. And they might say, okay, yeah, I'll do some more exercise. Finding creative ways to do that is, I found in the community, is actually kind of a fun way to get them more active. So for some people, if you say, get active and do more walking, is not as effective if you figure out, for example, that they love dancing and we say, hey, well, great, let's get you into some Zumba classes, or there's some free, creative dance classes, down at the community centre. Things like that also get them more engaged socially, I think are a great idea. And it's not working. Is it not working? Oh, here we are. Okay, so I've kind of gone through this already, but essentially social prescribing attempts to improve health by addressing some of these socioeconomic factors. So linking traditional clinical practice with activities and support services within the community. So a social prescription, as they defined in the UK, is a referral to one or more of these activities, which are typically provided by the local voluntary and community sectors. And according to the King's Fund in the UK, a social prescription is a means of enabling GPs, nurses or other primary care professionals to refer people to a range of local non-clinical services. Now, in the UK, this is just a great little picture here, in the UK they have what they call a link worker currently. So a link worker is someone that actually works closely with the GPs and with the communities. So if a patient comes to see a GP and then they figure out that they need to get them involved in various social or community activities, that link worker is then the liaison person, okay, for the patient and then the community. We don't currently have that here at the moment. If you have patients that are with NDIS or some other community mental health teams, you have case managers that can do that for you. And I'm very lucky in that position. So I work with patients that have case managers. And so when we talk about these things, I know that they're going to go and implement them. And I realise in primary care and general practice, with time constraints and also knowing where you can refer people is often quite difficult. Okay, this was the takeaway from the roundtable discussion they had. Essentially that our model of healthcare needs to adapt as we experience more growing rates of chronic disease, mental health issues and social isolation, which requires coordinated multidisciplinary care. So considering how we can move more effectively or influence consumer health and wellbeing by linking with services outside the health system. So rather than just looking at our mental health teams or our medical teams, is looking how can we actually build stronger communities? How can we get people to engage more with the community? Kind of covered that, so I don't think I'll worry about that. But essentially, a link worker is just someone who can give people time and focus on what matters to the person as identified through shared decision-making and personalised care. I believe the plan has been in the next 10 years with the through our Australian healthcare system is to implement something similar that they have in the UK, but we're not there yet. So this was the UK model. As you can see, so talking about regaining independence, new models of care and support with accommodation, doing well at home, supporting people to contribute to do things they enjoy, and staying well connected to the others and being resilient. And I think that's a really good model for helping our patients become more resilient and feeling like they're more connected. Just doing life well, I guess, would be the motto of that. In Canada, they're doing a pilot of social prescribing, and it's very similar, deliberate and structured way of referring clients from clinical practice to non-clinical supports. So this is Canada's social prescribing policy. So essentially you get someone with complex needs, they go see their primary care provider, usually their GP, and then again, so Canada has a link person or a link worker, so they can then refer them to the appropriate resources, and so they link them in with the, I guess, where they could find in the community that they could get that support. Okay, so again, just integrated approach. So this is just kind of recapping the same thing. I'll get to the more exciting stuff soon, which is actually what's out there. Okay, and recovery from illness. So an individual's ability to recover from their illness and live a contributing life in their community is highly contingent on social determinants, such as access to safe and affordable housing, education, employment, and community connectedness. So it all plays a really big part. We know that from the evidence, and we know that, I think, anecdotally ourselves when we see patients, and we know that if they come from difficult housing situations, if they're homeless, it's very difficult for them to recover. If they don't have any money, or if they're spending all their money on drugs, or they have no money for food, if they've got children, if they're having difficulties dealing with children, if they have a mental health issue, if their children have, for example, autism, and they need help with that, you kind of stop and think, where do we go from here? How can I help this person? How can I link this person in to best support them? Okay, why are we more isolated? Well, last year was a bit of a given with COVID. I don't think we need to really discuss that. But then there's also some suggestion that we spend a lot more time on smartphones and not as much time sort of face-to-face with people using eye connections. I think also we tend to be creatures of habit. So if people are living in a certain way and then something changes for them or a substantial life event changes, sometimes they're not really willing to want to change what they're doing. They'll want to stay in the same thing. Well, no, this is what I do every day, and I don't really go out and socialise. But if something has changed for them, then sometimes we need to sort of reach in and say, hey, here's a way we can connect you up with someone that might be able to help. Okay. So just going back in, so in terms of policy, so includes a goal to make primary healthcare more patient-focused, more accessible, and better able to provide preventative health and manage chronic conditions. So the Australian government has committed to implement a 10-year plan for primary care and commence the development of a national preventative health strategy. So I guess when we're talking about this in terms of day-to-day practice, the whole idea of social prescribing is going to be something that's going to be far more commonly implemented and encouraged to be implemented as a way to help our patients, keep them out of hospital, help them with recovery, but have stronger, more resilient patients and better communities. So our focus. So in general, we need to be more focused on our patients' multidisciplinary needs, more affordable and accessible, and that's a really important one, is the affordability. Because if I say to a patient, hey, you've got to exercise more, exercise we know is really good for depression, and they're like, I can't afford the gym, I'm not going to the gym. Okay, all right. And then we kind of either get stuck or we think, okay, how can we be creative with this? So for some people, even just getting a pet is really good, right? Walking a dog is fantastic. So if they have, they have to walk a dog every day, something like that is great. Also, things like counselling services. Some people can't even afford the gap to see a psychologist. So can we think of other ways? There are free counselling services that are out there. I know because there's pamphlets on the table, so they are available. So I know we have some patients at the moment that are desperate to see a psychologist, and there's like a 6 to 7 month waiting list to see a psychologist. So in that meantime, in terms of the safety planning, which Michaela beautifully talked about earlier, is there someone we can link them into? So if they don't necessarily have a group of friends that they can talk to, or a counsellor or psychologist they know, is there a free service that we can link them into? Okay, so new and different ways of delivering care. So I'm all about being creative in the ways that we do things, and that not necessarily everything is going to fall in and everyone's different. Every single patient is different. They all have different situations, different psychosocial situations, different habits. They have very different needs. So I think it's really important that we tailor our focus when we're dealing with patients to be specific. Okay, so social prescribing is just one component of a broader universal personalised care approach. Multiple components are involved, and the evidence suggests that consumers achieve better health outcomes when they have choice and control over the way their care is planned and delivered based on what matters to them. I think this is really important, this part about what matters to them. If we, like I said before, if we just say, go out and do more of this, or exercise more, or eat better food, and then you don't actually discuss with them what it is what's important to them. So for going back to the exercise, if they don't necessarily, they don't even like going to the gym. Let's be honest, most people don't like going to the gym. It's a bit boring. But if you can figure out ways that they are actually on board with it, and they go, yeah, actually, I want to do that. Like, I would love to do that. Or if they can have goals in their mind and think, yeah, I actually remember when I used to be really fit, and I'd actually like to do that because then I can play soccer with my son. And so if they're engaged with you in the planning process, then they're going to be more on board with doing it. But if you're just telling them, do more exercise, eat better, which I sometimes do, they generally won't really engage. And just in value-based healthcare, so the social prescribing model fits with value-based healthcare by broadening the care team to include service providers in the voluntary and community sectors. So just with a show of hands, who has like a database of free community services that they use already? People? Yeah. Okay, so a couple, yep, that's great. Sorry. Very limited, right? Exactly, right? And to be honest, as I was doing some research for this, I had a lovely friend of mine that runs the North Lakes Community Centre, and she gave me a huge list of free community services, and I thought, oh my goodness, there's so much stuff here we're not using. Even things like parenting classes. I mean, I have patients that really struggle with their kids, and I think, well, this is perfect. And even just make a friend. There are programs, if you have a mental illness, that you just go and you make a friend. Like, that's huge. For some people that are really, particularly if they have paranoid issues and they don't really want to go out and socialise, if they could just meet one-on-one with someone, just have a chat and make a friend, that's really great. But if you don't know they're there, then we don't know how to refer them on. And I absolutely understand it's really hard in general practice when you really push for time. Okay, so this is the pathway in the UK. So essentially, again, someone with complex needs, they come to the GP, and the GP refers to social prescribing services. So could be to do with learning skills, improving their skills, like adult learning opportunities. Learning to cook even is it's a basic skill that a lot of people don't have. So when I ask patients now, rather than asking them, do you eat well, I say, can you cook? Do you know how to cook? And by that, I don't mean like baked beans on toast. Like, can you cook? And for some people, they honestly don't know. So it's 2-minute noodles type thing. So I kind of, because I have that time, go into a bit more detail asking them those questions. Helping them get back into work. So we know that work and employment is protective for people. So if we can find ways to help them get back into work, that's very helpful. And activities, so engaging with a range of activities, improving their confidence, improving their social networks and their well-beings. So all those are aspects of social prescribing. Okay, this is not news to anybody, but that socioeconomic factors have consistently been found to have a greater impact on health than healthcare itself. Frailty and long-term conditions can have a devastating effect on social and physical activity, finances and relationships, which in turn can lead to a further decline in health and well-being. So we just need to be aware of all those other factors that are impacting our patients. What's the evidence? Okay, so obviously it's pretty hard to do a randomised control study on social prescribing, but the qualitative studies that they've done so far indicate that patients are satisfied with the social prescribing schemes, particularly valuing a trusting and supportive relationship with their link worker. Okay, the time and space to address social problems and the link worker's extensive knowledge of the range of community support services available. Now, I understand we do not have that here at the moment. Okay, so that is something hopefully that will be addressed, but in the meantime, if we're able to include that in perhaps our overall management of our patients and consider that, even making suggestions to them, even just having some brochures in clinics and being able to say, hey, you know what, I think you'd really benefit from some art therapy. You said that you love art and being creative, so I want you to go and engage in this. Just little things like that, finding out what they're interested in. I think if they know that we're engaged and interested in them, then they're more likely to sort of tell us and engage with us as well and be more willing to come along the journey with us. Okay, so at the individual level, there's evidence for improved patient care outcomes, patient satisfaction, quality of life, improved emotional well-being, confidence, self-empowerment, and reduced levels of depression and anxiety. All this evidence, by the way, you can find on the King's Fund website in the UK. The references are all at the back, so I just didn't want to print it all here. At the health system, so improved overall efficiency of delivering population-level care, reduced need for GP visits, reduced use of prescription medication, reduced ED visits, which is a big one, improved provider satisfaction, and increased integration between health and community support sectors. And it's jammed again. That's right. There we go. Okay. At the community level, okay. Increased volunteering. That's another thing that's a really great idea with this, is that patients that do have any kind of mental health issues, getting them involved in volunteering is also a fantastic way. If they're not quite ready to go back to work, volunteering is a wonderful way. So I have lots of patients that volunteer, like with Vinnie's and Salvation Army, wonderful social connections, and they're feeling that they're contributing to something, which is, I think, very important. Increased use of community assets. All these community assets are not being used enough. We need to use them more because they're there. And as Kathy, my friend, told me, she said, you make sure you tell everyone that you speak to that they're all here and they're free or they're very low cost. So they're there, we just need to use them. Okay, and who are we targeting? So our patients with long-term physical health conditions, who need support with their mental health, lonely or isolated, very big one, or people who have complex social needs that affect their well-being. Now, I think, and I think one of the ladies here mentioned earlier too, sometimes when people come to see you, they may not necessarily identify that some of these things are an issue. And it might be just a way of asking a few questions, even, like I will often ask patients, do you have any mates or friends that you hang out with? Do you have people that you spend time with? Anyone that you socialise with even on Facebook? Do you have a social network? And for some of them, they don't. For some, they might have just one or two people that they spend a little bit of time with. So it just identifies for us that need that, okay, this person's quite isolated. Okay, so the services, again, they're usually voluntary or community services, or by partnerships between health service commissioners and the voluntary sector. Okay, so there are some companies that provide the services, and I know if people are with, like, for example, NDIS, there are some things like there's Yukala at Batto Bay, and they provide some great services. Like, they even do music lessons. Pretty sure they do dance lessons as well. But just things that get patients involved with each other. Okay, what kinds of activities? So I'm not suggesting that you send people, scuba diving. That might be nice though, but I just like the photo. Okay. So schemes delivering social prescribing, be a range of activities. So arts, group learning, gardening, befriending, I love that term, cookery, healthy eating, advice, and a range of sports. So the different social prescriptions that we can look at. So arts. On the coast in particular, there's a huge budding, what's the word? Buzz? Yeah, buzz of lots of different art groups, creative groups, theatre groups, drama groups. I used to do musical theatre, by the way, so that's why I'm just a little bit more animated. So it can be a really great way to get patients involved into activities if, for example, they don't necessarily want to do exercise. And some of them are already quite creative themselves if you sort of dig down a little deeper and figure out some of them love drawing, or there's adult colouring in, things like that. So arts on prescription programs offer creative, workshops, dance, drama, music, painting and poetry to support patients with mental and physical health issues. So the research shows that creative activity has a positive effect on mental health related to self-expression and self-esteem, initiates opportunities for social contact and participation. That's a pretty amazing thing when you think about it for the patients that we see. Doing something like this, if it's going to improve their self-esteem, their self-confidence, their ability to socialise, and if that increases their ability, for example, to get a job or to get into volunteering, to meet someone, whatever it is. So I think if we can look at arts as a way of helping our patients. So a national study evaluating the impact of arts programs for patients with common mental health conditions, so anxiety, depression, different phobias and eating disorders, participants felt more empowered and confident and experienced reduced feelings of social exclusion and isolation. Okay, so just going back, so with the arts, so on the tables, I've put a couple of, there should be some brochures and things. One of those it's called the North Lakes Community Centre, and if you look through that, there's a stack of different free arts activities. So there's like art therapy, they have different classes that you can do, they have book clubs, they have all those sorts of things that you can get involved in, or you can tell patients to get involved in. Books on prescription is another thing. So for patients that might actually want to read or do their own kind of understanding, if they want to have their own understanding of what's going on, sometimes you can recommend a book for them to read, and you can say, look, I want you to go home and read this book. For some patients, that's just not going to happen, and that's okay. But for those that really like to read and get a good understanding of what's going on, sometimes having a list of books that they can read would be a good idea to do. So self-help books enable people to manage and understand psychological issues. Selection of books written and selected by health professionals employ cognitive behavioural therapy principles for common mental health conditions. Now obviously, it's ideal to do this in conjunction with counselling and psychology, but for those patients that do really like to understand and read, it can be a really good adjunct to using that. Getting them to access a public library is also actually a great way to get them involved. Because did anyone know how many activities libraries have on? Heaps, right? When you go to your local library, they have book clubs, they have, I think there was even something like what's that show? Not Star Wars. I can't remember what it was, but it was like a character. So they have like character clubs where they get together and they dress up. And I thought that's a great idea. They have, I think they have like chess clubs. They have cooking classes even. They have recipe sharing days. These are fantastic for patients. So sometimes even just getting them to your local library can be a great way for them to figure out what sort of things are available. Okay. Education. I think this is a really important one too, because a lot of patients that we see don't always have, for example, they haven't finished the HSC, they don't have a lot of education about even just how to do some basic things. So referring them to some adult course or adult learning opportunities is a really good idea as well. So basic skills. So if they can even learn how to, for example, manage their finances, that can be a huge thing. Just teaching them a course on money, or being able to budget. Being able to budget is a massive thing for people, and if we can help them to do that. So you'll find that there are some places as well that will have like free advice, free counselling on finance management and things like that. Okay, exercise. I talked about this before. Again, referring patients to supported exercise programs. So you will find there are often, particularly on the coast here, there's some great places that you can do group activities for exercise. There can be some free ones, some you have to pay for. Usually the gyms I have to pay for. But sometimes there's other different, like community centres will put on exercise programs or keeping fit. Like there's, Fit Over 50. There's like mums and bubs classes that help for people that have young children, particularly if mums are experiencing, if they have a mental health issue themselves, postpartum, and they're not getting any exercise. That can be very helpful for them, because it also not just gets them exercise, but they get connected with other mums too. And I think that's really helpful. Even though I remember after my second child and I had a young one, the idea of exercising was just terrifying, because you've got to take these two kids and then you already feel conscious about, your post-baby body and stuff, and then jumping around and all these other, it is a bit terrifying. But when you actually get there and there's all these other mums that are all feeling the same way, it's actually really powerful, and you make some great friends, and it's a good thing to think about. So, because I know we often see a lot of mums with new bubs or babies or young kids, so that can be something to think about too.
Sara, I interrupt. I think it's really helpful to lose the word exercise and replace it with the word activity.
Sure, I love it. Yep.
As you say,
no one likes exercise. I know, right?
We all love doing stuff.
That is so good. I love that, actually. That's a great... I just took this from the research they'd done, but I actually love that. I think that's a great idea, because taking it from exercise has this idea in our mind, they're like, this thing is just so hard. Whereas activity is like, yeah, go out dancing or do whatever, or something that you love, right? It's like if they can find something that they enjoy, like dancing, Zumba, kayaking, whatever it is. So I think that's fantastic. Gardening is perfect. Yes, gardening is a great one. Cooking, yes. But it is, right? But also, because I think cooking's also very relaxing. Well, I find it very relaxing. I find cooking very relaxing. And I know some people don't necessarily find it relaxing, but it's also if people that do cooking classes, for example, they have that social connection with one another, they can start thinking about healthy ideas for recipes and all those sorts of things. Yes, but in terms of exercise, I don't know, unless you like lift a really heavy pot of, but yeah,
That's activity.
exactly,
And,
yep.
and what we've just sort of touched on is the combination of activity with creativity.
Oh, it's
And
amazing.
if we put those two words to our patients, I think, and my experience is that we get a lot further.
Yep, perfect. I think that's brilliant. And it's such a better way to put it than saying do more exercise, because they're going to be like, no, not going to happen. But if we, like you say, find out what they like doing. I know one of my patients is sort of with schizophrenia. She's very isolated. And we're trying to figure out ways to get her out and about to do things and connect. And the one thing that she does really like is music, and she's got a guitar at home. So we were like, oh, well, why don't we get you into some guitar lessons? Because number one, you can connect with some people, you can learn a skill, gain some confidence, and who knows where that will take it. But she was really excited by that idea. So rather than, just get out and see more people and do more things, it's let's find what you like, let's figure out a way that you can do it. And as it turns out, Yukala at Bateau Bay they do free, music lessons. So that was a great link in for her. So just finding out what they like, and I think that's fantastic. So thank you. Yes.
I live in Newcastle.
Oh yeah.
Region. However, I have just been working with some families who have just discovered it's called Bowls Break the Brain.
Oh.
And it is amazing.
Really?
And what you just said about the guitar.
Yeah.
So they encourage, it's a beautiful space for people with mental health. You come and get together. They learn how to play bowls.
I love it. Yeah.
But they also take along guitars.
Oh my gosh.
Someone takes along their harmonica, and so it's just a great connection.
That is so good.
Bowls break the brain.
And where's that based?
So there is one on the Central Coast. I just googled it.
Oh my gosh. See, there we go. Bowls, great for me. There you go. That's amazing. Thank you so much. And that's the exact sort of thing that I'm talking about, which is ways, and it sounds like a good family activity. So, for...
Some people are affiliated with NDIS. It's a free service.
That's great.
And you don't have to be an NDIS participant. Some support workers through the health service will actually take their clients.
That's so good.
So yeah, it's a great program.
So good. No, that's fantastic. Thank you for sharing. If anyone else has any things that you want to share or things that you've come across, that would be great. I'm always looking for more things that we can refer patients to.
The team who work with me all the time will be fed up with hearing these patients, but there is a great free location-based app called Ask Izzy that may be very beneficial to GP.
What's it called, sorry?
Ask Izzy.
Ask Izzy.
If you just Google that, there's Ask Izzy, IZZY. It is 16 different categories, and because you put in your postcode for where you are, or you can choose the postcode where the person lives. And each of the categories, so it might be housing, it might be activities, it might be financial support. If you put in, click on the category, it will list the services in the area that are available for each of those categories.
That's fantastic.
Yeah, so yeah.
That's great. Thank you. It's perfect. So there's heaps of stuff out there. It's a matter of kind of linking them with us and knowing how we can get that process streamlined, which, ideally a link worker like they have in the UK would be great, but we don't have that here. So figuring out how we can do that, particularly for those in GP practice, it's, having the time to then sift through and go, this is what you could do. But maybe having a list of those community services in the practice in terms of brochures and knowing that you can sort of suggest for them to use something. So this, again, just sport and exercise. Oh, sorry, I'm so sorry.
That's right. I was just going to say that there's a recent annual in medicine in the US, and it actually looked at the role of exercise in the management of mental health disorders. And it said basically it's not the exercise that matters, it's the value that they place on the activity. So
That's so great. Which is kind of what you were saying, it needs to be.
And that's the key, and that's what keeps them involved and engaged
Oh,
long term.
absolutely. I think that's fantastic. Thank you. And again, it's kind of getting away from that strict, I guess, medical approach of just exercise, but do something that you love, you enjoy. It's going to keep you engaged, hopefully social and meeting people and having that shared experience with someone else while you. I mean, and it doesn't work for everybody. Like I prefer, for example, just to go for a run and just, bang it out because that's my downtime with some headphones and that's great. But I know for other people doing groups is much better. So going and doing a class or engaging. So it just depends on the sort of personality. This is just from the UK again, the importance for mental health for exercise. But you're right, we should change that to activity. Why it's important for mental health. We all know this. I didn't really need to put this up there, but this is what they use for their patients in the UK, just to help encourage them as to why they need to keep active. So research into the effects of exercise reported reductions in anxiety, depression, negative mood, with increases in self-esteem and cognitive functioning, concluding that exercise was a neglected intervention in mental health care. So we need to promote more activity. Biological basis for exercise is that it releases naturally occurring morphine-like neuropeptides, endorphins, produced by the central nervous system and pituitary gland that inhibit pain signal transmission and produce feelings of euphoria, which doesn't happen for everyone when they exercise, but generally that's the biological basis for doing it. But then there's also obviously the cognitive and the emotional side of doing something that you really enjoy. I just thought this was funny. That's how some people tend to think about exercise, right? I exercised last month. I don't need to worry about it again. Okay. Green gyms or ecotherapy, so getting people out into nature. So supporting our patients becoming physically and mentally healthier through contact with nature. So walking in parks, developing green spaces. And I know on the Central Coast you've probably seen there's loads of those outdoor gyms now that people can go and use. Not that I ever see anyone on them, but they're a great use. And they've got those beautiful pathways on the Central Coast, especially like you've got those along Tuggerah Lakes, and there's the around the beaches. They use them for like personal training and things like that. So encouraging patients to get out into nature. It's also great family activities. So if they have kids, going for bike rides, going on their scooters, taking the dogs for a walk, going to dog parks, going to the beach. There's so many different options for getting them outdoors and participating in what they call ecotherapy. Oh, it's just a lovely picture of a family going for a walk. Okay. Healthy living. This is one that I'm particularly interested in. So using social prescribing to support health improvement and address inequalities by targeting disadvantaged sectors of the population. So this could involve things like health checks, healthy eating, exercise or activity, smoking cessation, and it aims to give hope and encourage people to try different activities, develop new skills, make friends, and have an enjoyable time. I think one of the hardest things with the demographics of people that I tend to see in the community mental health sector is that a lot of them smoke, a lot of them don't eat well, a lot of them don't do any kind of activity or engage in anything, and trying to encourage them to do something like that is often quite difficult. Does anyone else struggle with that with patients, or is it just me? Just me? Thanks for the vote of confidence.
You need to though remember the impact of side effects of medication.
Yeah, oh, absolutely. Absolutely. Like if they're on olanzapine, almost forget getting them out. And that's a really big point. And you know what? In general, other side effects too affect them. So, I'm not going to touch on it here, but things like erectile dysfunction, dry mouth, xerostomia, big problems with that I see all the time in the community. So my patients come in and they haven't really thought about it, but their mouth is dry and they don't do anything about it. They don't see the dentist. They don't brush their teeth. They wash their mouth with Coke or juice. And then you're like, oh. And then you wonder why their teeth are going black. And then that affects their confidence, right? They don't want to go out in public. They don't want to smile. They don't want to go for job interviews because they're not, their teeth are affected. So that to me is something else that's really important to address with patients. And I try and do that with each patient I see, is give them tips on how to manage that. I'm like, please don't drink Coke. Just please don't drink Coke. Just have water. Have mineral water. I don't care. Just don't drink Coke.
Coke is actually a good one, a good example, because if you consume a big bottle of Coke on Tuesday or that's your calories.
Oh, I know. Don't get me started. I'll say.
I think it's good to have that approach, but it's just simple things like that. The soft drink in itself contributes to the higher level of obesity in this population.
Oh, absolutely. And a lot of patients, like you said, that's what they'll drink. And then the other food is even worse. Like they'll then go to Macca's, or they'll eat. So their general level of nutrition is pretty bad. Oh, yes.
So,
Yes.
unfortunately, that's actually killed us in terms of calories very often.
Yep, absolutely. Yes, that's a really good point, because then they just keep on eating the rest of the day. So I have tried with some patients, and I'll say, look, why don't you try just getting mineral water and just squeezing some lemon juice or some lime juice in? And they're like, I don't know, it sounds like it's going to taste pretty bad. I'm like, just try it, okay? And then I'm like, look, just try it, and then tell me when I'll see you next time, and we'll see how you're going. The other thing, even just with eating, like if I say, do you do your own shopping? Yeah, I do my own shopping. What do you buy? Oh, frozen meals. Okay, all right. So like frozen pies and sausage rolls. Yeah, I'm still cooking. I'm putting in the oven. Okay. So having those discussions with them too is, I think, really important. Well, you need to eat more fresh foods. You need to eat more vegetables. If that's a problem, or if finance is an issue for doing that, then there are some places you can get free food, which I'll go through a bit later. Yeah. So that's pretty much, when my patients say they're eating well, that's their diet, which I'm like, oh, okay, we need to address this. These are just some of the things that I do in practice, which can be difficult, but just getting them to change one thing at a time. If it's just, for example, cutting out Coke is a huge thing for most people, so that's great. Minimise processed foods, educating around hidden sugar, swapping out soft drinks, encourage different ideas for cooking, community cooking classes, Facebook groups. There's loads of Facebook groups with really great cooking groups and recipe ideas. We know from the research that Mediterranean-style diet is best for mood as well. Fresh is best, as always. And just celebrate the small wins with patients, I find. Even if they just do small little things and they come back and say, oh, I only have like a 600ml bottle of Coke now instead of a 1.25. That's great. So just small little things make a big difference. So things like that I just share with patients so they understand the concept of how much sugar. The World Health Organization has stipulated that we shouldn't really have any more than 9 teaspoons of added sugar per day per adult. I think the average Australian has about 20 or 30 teaspoons, something like that. So just getting that down is really important. Particularly if they're on antipsychotics, like olanzapine, and they've already got metabolic issues, and just again with dry mouth. So I've seen this a lot, and one of the things we're trying to implement in the community practice at the moment is making sure that when they do go on to antipsychotics, that we get them to see a dentist fairly soon, because according to the dental, I don't know what you call their research, they recommend that if someone's on antipsychotics, they should see a dentist at least 2 to 3 times a year. I don't know any patient of mine that sees a dentist 2 or 3 times a year if they're on antipsychotics. If you put them on 2 or 3 antipsychotics, then that's even worse. So just something so when we're considering the whole patient, because that does tend to have an impact on their self-esteem as well.
Access to dentists
Oh,
in a reasonably financially acceptable way is impossible.
very difficult.
And there's certainly very, very little access through the public system.
Yep, yep. And this is something that I've been speaking in the community where I'm with about, because I'm just really passionate about the whole person and not just looking at one thing. But with things like dentists, is there a way that we can organise for these patients? Because the ones that we have with NDIS or that have a case manager, we're able to sort of get them in to see certain dentists, I believe, and they can get it at a much lower cost. But it would be really good if we were able to organise so that patients that are on antipsychotics have a way to access dentists at a much lower cost. I don't know how we're going to do that, but that would be something that I would be really interested in.
Getting access to NDIS for these patients.
Yes, yes. I hear you. Yeah.
There is a free dental clinic on the Central Coast campus of the university.
The one at Arimba? Yes.
They're actually currently advertising for patients.
Oh, great. Okay. That's fantastic.
You don't have to be with it's free, and you go and you get an hour and a half dental check and then follow-up treatment. Two a certain.
They see two dentists essentially with their trainees, and then someone comes and checks their work.
That's great. That's great.
Just put pamphlets in our building to advertise they need more patients.
Dental project, because I think we've got a dental project, but I don't know the details of that. We're about to present to them, but there are some projects, I think we all recognise it's a major issue. But that's great to know about they're looking for patients.
That's great.
That's great news.
It's wonderful.
They won't need to.
Yeah. Where do these people come from? No, but that's great. We'll have to get the information and put it in the clinic because it is a big. As we all know, it's a major issue. So I just wanted to put up some examples of some, I guess, services that are around. So this is the Lakes Food Care in Toukley. So people can go here and they can get sort of free food or low-cost food. So all this stuff I've got in the pamphlets on the tables. So, and if you need it, or I can probably email to someone or email to Deb the digital links for all these things as well. So you can do information referral too. So this is pretty much just having brochures in the clinics and then letting patients know, hey, you know, try this, try that, or why don't you go and join this? Supported referral. So this is a bit more if you want to refer them to a particular place. You need me to stop? Wind up. How long do I have? Like 2 minutes? 1 minute? 1 minute. Okay. All right. Referrals. Okay. Let's go. Oh, okay. This is pretty much the end of the thing. So these are just examples of some things. So emotionally intelligent parenting, fantastic for patients that might have, for example, borderline and they have difficulty managing their own emotions. If they then have a child that's difficult, can be chaos. So helping them to manage that. The Supporting Families program, We Care Connect, the Family Connect, parenting programs, Need a Hand Up, San Remo Neighbourhood Centre, so relief for families facing financial hardship. At Gosford and Wyong, so family and care and mental health program, free support groups. Counselling, so free counselling if you need to talk to someone. In Kalonga Bay Community Cafe, so meet new friends. So I believe you can get like a free coffee. You go along there and that's run through the Uniting Church and supported by a few other companies. Play groups, okay, for parents. Sensory workshops, so for those that have emotional problems or emotional dysregulation. I'm going. Baptist Care Counselling, Family Services, Mendu Care, Family Support. So you can see there's loads of stuff around. I was going to do a case study, but I don't have time, so that's fine. That essentially is the end of my presentation.